Diabetes mellitus is a group of metabolic diseases caused by high blood glucose levels, often arising from malfunctions in insulin production or action. In the classical world, it was known as sweet urine. Hyperglycemia results from higher levels of blood glucose. It is also known as sweet urine. Peripheral glucose levels tend to be tightly managed by insulin, a hormone produced by the pancreas. The pancreas releases insulin to lower glucose levels when blood glucose is raised, for example, after eating a meal. Patients with diabetes have difficulty controlling blood sugar levels. Diabetes is a chronic disease, so it is often a lifetime condition that will remain controlled. Over time, diabetes can cause blindness, kidney failure, and nerve damage, all of which have ties to damage to small vessels called microvascular disease. Diabetes is also responsible for advancing atherosclerosis, causing strokes, coronary heart disease, and other prominent blood vessel diseases. This is also known as microvascular disease. Diabetes affects 17.5 million individuals in the United States, approximately 8% of the population. In addition, roughly another 12 million people in the United States have diabetes and aren't aware of it. The average annual cost of treating diabetes in the 1990s was estimated at $98 million in the United States. Per capita annual medical costs for people with diabetes were estimated to be $10,071, while those without diabetes were estimated to be $2,699. During this year, 13.9 million days of hospital stay were caused by diabetes, while 30.3 million doctor visits were made related to diabetes. Globally, as the statistics are staggering, these numbers reflect only the population in the United States. Death is the third cause of death in the United States after cardiorespiratory disease and cancer. Insufficient production of insulin, either excessively or in relation to the body's needs, production of faulty insulin, rare, or the inability of cells to use insulin efficiently and adequately causes hyperglycemia and diabetes. The latter symptoms involve mostly fat tissue and muscle tissue cells. Usually, a state called insulin resistance does short-term damage to the production of insulin in the body's pancreas, resulting in type 2 diabetes. The ideal treatment for this condition is administered to the pancreas to restore its insulin-producing ability. Type 2 diabetes is also accompanied by a progression of beta cells that primarily contribute to extreme blood sugars. Basically, if somebody's reaction to insulin is struck by insulin resistance, the body's production of insulin may not be strong enough to compensate for that. Over time, if the output of insulin falls and insulin is no longer released as forcefully as it should, high blood sugar will form. Glucose is a simple sugar found in food. Glucose is an essential nutrient that furnishes energy to maintain body functions. Carbohydrates are broken down in the small intestine, and the glucose in food is digested by the intestinal cells in the blood and carried by the bloodstream to any cell where it is used. However, glucose enters the cell without insulin, but glucose cannot enter the cells alone. Insulin is needed to facilitate the transport of glucose to the cells. Without insulin, the cell becomes starved of energy. In certain types of diabetes, the accumulation of waste products caused by an inability of cells to use glucose leads to what's known as starvation in the midst of plenty. The ample, unreplenished glucose is excreted in the urine. Specialized cells in the pancreas, called beta cells, create insulin. In addition to helping glucose pass into cells, insulin also governs the glucose level in the blood. Following the consumption of a meal, the blood glucose level rises. In response to the increased glucose level, the pancreas typically reduces insulin levels in the bloodstream, allowing for the entry of glucose into the cells and helping to lower blood glucose levels afterward. When the blood glucose levels are low, the insulin released by the pancreas is turned down. Keep in mind that, even during the fasting state, there is a significant, slowly varying. Matthew, a survivor of cancer and stroke, requests that you help spread awareness of severe diseases by publishing this video. Please take a moment to subscribe to and like this video.